One of the most common questions I'm asked by patients is whether or not Botox is safe. A lot of patients ask, why would a neurotoxin be safe to inject in your face? And what do they mean by neurotoxin? I remember my grandmother telling me stories about botulism. Is this the same stuff? Well, those are all really good questions. We call Botox a neurotoxin, but it's a little misleading. Neurotoxin implies that it's actually damaging to nerve cells, or it actually could kill nerve cells, and that's not how Botox works. Botox is called a neurotoxin because it has effects on the nervous system, but more specifically, as we use it cosmetically, on the nerves where they meet and communicate with the muscles. Now, we most commonly use Botox on the frown muscles. We sometimes use it in the forehead muscles and in the smile muscles around the eyes. What happens when we inject Botox into those muscles? Well, Botox is actually a protein. It actually binds to the nerve endings where they communicate with the muscle cells. And when the Botox binds to the nerve ending, it prevents the release of the neurotransmitter that leads to muscle contraction. So what's happening with Botox is it's inhibiting or preventing the communication between the nerve and the muscle, and therefore you can't contract the muscle. Now we know that certain muscle groups in the face actually lead to signs of facial aging, like wrinkles and crepey skin. So, is this the same as botulism? No. Botox is a highly purified form of the botulinum toxin. There are actually a great many toxins in what we traditionally think of as botulism toxin, and this is a highly purified form. It was purified by a scientist in San Francisco who was looking for ways to treat eyelid spasm. This is a very rare but very debilitating disorder where patients have uncontrollable eyelid spasm. And the great thing for patients considering using Botox today is that patients with eyelid spasm started to be treated in 1989. So we have a 20-year group of patients, or we have a group of patients who have been using Botox for eyelid spasm for 20 years, and to my knowledge, they've had no deleterious effects from the repeat use of Botox for treating that. Now, Botox is used for more things than just cosmetic. Botox is used quite a bit now to treat spastic muscle paralysis in children. And when it's used in those treatments, it's used in very high doses relative to the doses that we're using for treating wrinkles in the face. So, when we're treating wrinkles in the face, we're using a very small amount of a highly purified agent that's active on nerves. Now, could this be a permanent effect? Well, the answer is no, and some people frown, or if they could frown, would frown because they like the effect. But that's actually one of the beneficial things about Botox is it's a temporary effect. So even if the Botox is used to excess, it's going to wear off. Interestingly enough, what happens is that the nerve endings actually sprout new endings around the blockade. So it's kind of like traffic going around a blockade, and then they communicate with the muscle as well. What you do get with Botox, which is nice, is you do get a cumulative effect. You not only get the benefit of the muscle being weakened or temporarily paralyzed so that the wrinkles of the skin tend to lessen or go away, but the muscle over time atrophies to some degree. And so what I see in my patients is that over the course of a couple of years, they're able to use the Botox less frequently to maintain the same effect. And that's certainly not true in everybody, but that's true in a significant percentage of patients.